Good afternoon, everyone. Bonjour à toutes et à tous, and thank you very much for being part of our live audience today for our Research Week panel discussion on client and family-oriented research. My name is Florence Dzierżinski. I have the privilege to serve as the president of the Institute of Mental Health Research and vice president research of the Royal. And today I am joined by a client, a caregiver, a clinician scientist, and our director of clinical research administration, all of whom are working towards deeper integration of client and families in care, education, and research. So the goal of our conversation today is to pull back the veil on mental health research by highlighting how it is shaping care here at the Royal. And one of the themes throughout the strategy is the power of hope and new possibilities. So as we know, hope is a powerful difference maker in life and in care. Hope can be generated by the perspective of new possibilities. And that is what research brings, new possibilities. Finding a treatment and covering what has eluded so many, and the hope that we see in our clients and their loved ones when we figure out an approach that enables a better quality of life. It is powerful. As we know, a key tenet of the Royal's new strategy is to deliver evidence-informed, client and family-centered care. So to support this and to generate knowledge that is translated into practice, we are aiming to establish a client and family-oriented research framework, which is led by some of our panelists today. So this approach is really part of the global movement, which really recognizes the power of bringing lived expertise in the process of providing care and designing research. So without further ado, it is my great pleasure to introduce Michele Langlois, Chair of the Family Advisory Council and co-chair of the Royal's Client-Oriented Research Committee. Peter Winfield, representative of the Client Advisory Council and co-chair of the Royal Client-Oriented Research Committee. Dr. Michael Seto, senior clinician scientist, director of the IMHR Forensic Mental Health Research Unit, and Tammy Beaudoin, director of clinical research administration here at the Royal. Thank you all very much for joining us today. And Peter, I'll start with you. How did you become engaged in research?
Well, it was actually a very lucky accident. I never would have imagined myself in this position. I've always been interested in science and research, but I'm not a scientist, and I certainly never expected to be in this position, especially being able to contribute to mental health research. But a couple of years ago, after working for quite a long time in healing with my own PTSD, I found myself in a pretty good place. I wanted to give back, and I chose to do that with the Royal because that's where my healing journey really began, and they helped me so much. And it just happened to be a lucky moment because this was when the Royal was implementing its new strategic plan. So this was essentially a new era, really, in mental health care, where the tables have been turned a little bit and a new emphasis has been placed on the lived expertise of clients and families. So I volunteered for the Client Advisory Council, and just lucky enough, the Research Council had been stood up just around that time. And well, honestly, it was you, Florence. You reached out to me and asked if I was available, and I very happily volunteered, not knowing what I was getting into. I certainly had a very steep learning curve, but the bigger adaptation for me has been my interaction with, quite honestly, very highly trained scientists, many of whom are leaders in their field, and indeed many of them are recognized internationally for their work. So, I feel like I was a fish out of water as a non-scientist and a client. And I can tell you that initially it was somewhat daunting to be put in a position to collaborate with mental health researchers. And so it took a little time to calm my nerves. But I did realize that there was room for me as a client to make a meaningful contribution. So what I found over the last year is that these researchers, these scientists are actually really nice people. They're friendly, they're welcoming. And in fact, they're actually eager to hear about the perspectives from clients and families. And they're genuinely trying to find meaningful ways to incorporate our thoughts and our views into the work they do. So what brought me to research, and in fact, what keeps me here, is the opportunity to work with some pretty amazing people who are making differences in the lives of people like me suffering from mental health challenges.
Amazing. Thank you, Peter. And Michele, I will ask you the same question. How did you become engaged in research?
Awesome. Good afternoon, everyone. And I would say my interest sparked decades ago, first as I accompanied a sibling and then later my daughter through their journey back to wellness from serious mental health conditions. And I would say that a lot of my energy comes from curiosity, which led me to journal and reflect upon my experiences as we journeyed together. And I recall asking every clinician, specialist, and physician that I met, what is the best stance for me as a care partner and for us as a family to take standing with our loved ones through these experiences. And this is how I learned personally how to walk in lockstep with our loved ones as they went through their journey. Now, about that journey, I learned that there is a measure of struggle from our own experience, but as well as through the experience I've learned from others. Struggle, suffering, and deep questioning for everyone in that constellation, which oftentimes extends into the workplace and into, let's say, a school environment. At one point, I became really curious about other families' experiences, and then that led me to work more directly with families. And I learned that although each situation is unique, there is a lot that we have in common and that we share. And as a result of my firsthand experience and what I witnessed, the life-affirming impact of psychoeducation, skill building, and peer support, I decided that I want to learn more and I want to be part of the team that helps contribute to the knowledge so that every family can have this knowledge and these tools in their toolkit to accompany loved ones.
It's fantastic. Thank you both, Michele and Peter, for sharing with us. And, there's certainly a thread in your thinking about the curiosity and the spirit of inquiry and how can we improve situations and systems. So thank you very much for sharing. My next question is going to be for Michael. And as our resident clinician scientist, Michael, can you tell us about your experience integrating lived expertise in your research and how it has evolved over time?
Yes, for sure. Good afternoon, everyone, and thank you for that question. I think Michele said it perfectly, mentioning curiosity, because to me, that's the lodestar for my interest in research, right? It's like you're curious, there's questions you want to answer, and my experience, my training, and my inclination is to try and answer questions that can circle back and be used to help people more. I've been a clinician scientist for most of my career, and just reflecting on that in preparation for this panel, I realized that there were so many times that some of the research questions that I pursued in my work in forensic mental health have been driven by questions raised by clients or family members. As a psychologist doing an assessment, for example, someone would ask, what's the validity of this tool specifically for someone like me? Or, how are the results of this assessment going to help in terms of, what's going to be offered to me? Or, people have made this recommendation for a particular program or treatment. What's the evidence about how it's going to help? And often there was evidence, there was research that we could draw on, but many times over my career, there have been times when I would look more into it and realize that there really was a gap. There was maybe a little bit or maybe nothing at all. And that, of course, really then piqued that curiosity. I really wanted to try and understand, what are we doing? How could it be helpful to the clients? How can it help? Another way that people who've lived, with lived experience have been tremendously helpful in terms of the research side of things. It's been a long-standing custom of ours when we finish the research that we do a debriefing where we take opportunities to share the results of the research with people who've participated, because they've contributed their time and their energy and their efforts and shared their experiences with us. And so we would make little posters or have feedback sessions or do different things, public lectures and so forth. And again, on hearing the results, people would often come back with great thoughts about what the results meant to them, follow-up questions, ideas for further research. And that, again, often would stimulate a new path for us. What I've been really excited about is more recently, that's really kind of reflecting client and family experience at the beginning of the research, right, with questions asked, and then again at the end as they hear the results. What I've been really excited about is more recently recognizing that there's an opportunity for that engagement throughout the process of doing research.
Thanks for that, Michael. And Michele, I'll come back to you. We've spoke at length about meaningful engagement of caregivers including through a CHR-funded project led by Cynthia Clark. And many caregivers are interested in learning more about what's going on at the provincial level, at the national level, regarding strategy for patient-oriented research. And that includes clients and families. Can you give us a bit of an overview?
Sure, Florence. Thank you for your question. First off, SPORE stands for Strategy for Patient-Oriented Research. It guides a community of partnerships between the Canadian Institutes of Health Research, as you pointed out, the provinces and territories, philanthropic organizations, academic institutions, and health charities. At its core, SPORE is about generating and ensuring the dissemination and the put into practice of evidence needed to inform the development of health policies that improve the healthcare system. It puts clients and families at the center of new research grants available. And as a strategy, it boosts research that generates knowledge to inform policies that translate into very tangible and measurable improvements that clients and families would recognize in the communities that support them. Now, there are a few key principles that ground the work. And first off is that the lived expertise of clients, and by extension, their care partners and or families as they define them, is really valued and stands alongside the expertise of others on multidisciplinary research teams involving like the researchers, the clinicians, and policymakers. Clients and families serve as on these teams throughout the research process and life cycle. And in some case, can be a primary investigator. And I'll talk a little bit about an example there. But they also ensure that the questions and for the research guide them to answers and results that are relevant and important to them. And then the sponsoring organizations commit to embedding whatever they learn and baking it into policy and practice. There are examples of SPORE research nationally. There's research that has been funded that shows how to recruit and retain study participants, for example. But in Calgary, parents and youth actually came together to steer research and create a network to help children with brain-based developmental disabilities. In another case, I believe it's in Ontario, a new model of care was developed resulting from families and clients and youth coming together. And it resulted in drop-in centers for youth experiencing mental health to get on-the-spot guidance and support. And closer to home, we recently launched engagecaregivers.ca, which featured the knowledge products to inform meaningful engagement framework for service providers. So they have tools and guidance now to help guide their efforts in engaging clients and families throughout the full spectrum available to them of engagement at all levels of the organization. What made this one really, I guess, interesting is that Cynthia Clark served as the expert family advisor, was the principal investigator of this particular research. We also have recently funded research examining therapies for people with schizophrenia, spectrum disorders. And then we also have one looking or exploring screening tools for cardiac patients, because it is shown that oftentimes they also experience issues with depression, sleep apnea, mood disorders. And so by putting information in the hands of clinicians, for example, at the Ottawa Heart Institute, with assessment tools, they can really quickly match clients to treatments and care that they need. Yeah. So it's a very exciting time.
Very exciting time. I know it so happens that, of course, the Royal and the Heart Institute are close partner in the study of the brain-heart connection and the impact of these comorbidities. So a good ecosystem building right there for us. Thank you, Michelle. Now I'll turn it over to Tammy. And Tammy, throughout your career, you've witnessed firsthand the power of client and family engagement in research. And I know you have seen, a number of success stories. Can you walk us through a few of them?
Absolutely. So client and family engagement is just a passion that I've developed probably over the last 10 years. So whenever I speak about client and family engagement, I have to go back to the very first time that I was exposed to this. And it was a story that really resonated with me. And I was attending a talk, and the speaker was talking about living with rheumatoid arthritis and what it was like for her in her journey. And she had become a patient partner through various means, and she, was involved in various societies and provided guidance on various committees. And she said the one thing that really struck her was that no matter who she talked to, whether it was a physician, a nurse, anyone around the table, or researcher, they were very, very much focused on the pain associated with rheumatoid arthritis. And for her, she was quite taken aback by that, because she said the pain was not the problem. The pain was really well managed with the medications that are currently on the market. The problem for her was the fatigue associated with those medications. And the physicians were looking at pain and pain management and had not even considered the fact that maybe the side effects from these medications that were so beneficial needed to be addressed. How do we address that? How do we make sure that quality of life improves for these clients and these patients? So she brought that to the table. And since that talk, when she spoke about that, it just really meant something to me that, we're no longer in the days of like our grandparents, where if the doctor said this, that was the gold, like there was no other option. I think now patients have a voice, and that's really important. So that was the first story, and that was the first time that resonated with me. That particular patient partner went on to lead some of these committees, but also she's a patient editor for the British Medical Journal, which is a high-end journal for various medical articles. So she took what she knew and she really expanded on that. I think the second story comes to me is from my previous experience. So before I joined the Royal, I was in an acute care facility. And so there was a lot of research happening. And one of the big success stories actually was related to a blood clot. And so a young gentleman came in, he had been diagnosed with a blood clot in his leg. And during the exam with his hematologist, he mentioned to him that there is a connection between unexplained blood clots and cancer. There's a relationship there. So this was quite concerning to the participant. You can imagine that this patient has just been told he has a blood clot, he needs to start treatments, and now he's being told he might have cancer somewhere in his body and he should undergo scans and cancer screening. So the patient started to ask questions. He asked, well, is this really helpful? Does the screening help? If I have this CT scan, is it going to tell you more than if I didn't have the CT scan? And the more questions he asked, the more the doctor realized, I don't really know the answers to this. We don't have the answers to this. The gold standard says we should do this. We don't know why we're telling people we have to do this. And that was the birth of a new study. So they worked together, they collaborated. And in the end, after a huge study, a lot of recruited participants, they realized that the additional procedures, the additional scanning, it didn't have any higher detection. So patients were being put through this added stress, added exposure to radiation, added visits, and it didn't have a benefit. So not only did that change practice around the world, it has reduced expense related with those tests. It's reduced the burden on hospitals. And all of this stemmed from just a question that was asked by this patient. And that patient still goes around with his hematologist and presents that study and speaks to that study because it's changed practice internationally. So I think, it's really important to see that researchers view issues with an academic and scientific lens. Clients and families bring a whole new level of expertise to the table. They have that real life, everyday experience that they can speak to, the struggles, the successes. And when we combine that knowledge, we have an opportunity to develop research that has the power that can reshape mental health and substance use care for our clients and even the experiences our family members have when dealing with these patients. So those are just two examples, but there are so many examples of the value of having that client voice involved.
Oh, that's fantastic, Tammy. Thank you. It really, again, connects the dot between, the spirit of inquiry and an impact on a evidence-informed client-centered care. So thank you for that. And Peter, I'm coming back to you. And I think many audience member may wonder, how do I get involved? What are the kind of activities that I could consider to be involved in such an enterprise?
Well, that's a wonderful question because things are changing and quite dramatically. It used to be that the only way we as clients or patients could be involved in research was as participants. And that's still the case. I mean, there's still a huge need for people who are interested to participate in research as participants, where for the most part you spend a lot of time answering questionnaires, and we still need that. But the sort of spectrum of engagement has expanded quite dramatically. So you can also contribute as an advisor or a consultant. You could be a co-designer of a study or even a co-lead, right up to the potential to lead research. Now, I think we all recognize that the more involved you get, especially with regards to leadership, there is a requirement for a certain degree of knowledge and skill. And that can be a challenge for many clients and family members who don't have that. So some of the work we've been doing on the working group is recognizing this and developing a curriculum to support clients and family members who want to participate, a curriculum that helps you understand what the research life cycle is, what researchers actually do. We can help you, we want to help you understand the terminology even, because language can be a barrier if you want to participate meaningfully. And so terminology and vocabulary in research is important, and this is something that we plan to build into our curriculum to help people. Now, interestingly, as a little aside right here, I know the researchers themselves have questions about how they participate in this new model. So the curriculum involves courses for researchers to answer the questions they have on how to engage in this sort of new paradigm shift that we're involved in. But to directly answer your question for us, for anybody who does want to participate in research, the best thing you can do is go to the Royal's website. There's actually a really good page. It's called About Clinical Research. And that section actually answers most of the questions anybody would want to know. It tells you about what clinical research is, tells you who can participate, what the criteria are. But more importantly, it has two other sections. One section is a list of all of the studies that the Royal and the IMHR are currently running that are recruiting. So you can see what studies are being run, what kinds of research they're doing, and what kinds of participants they're looking for. That's available on the website right now. On that same page, there's another section where you can register yourself in a research registry. And so when new research comes up, you'll be notified, and depending on how you answer the questions, you'll be asked if you are interested in participating. And before I leave this question with you, there is one question on that page that's very important too. It's about consent, right? It's about understanding, you know, the website and the Royal. We want to help you understand what you're signing off on. And actually, this has been a big part of our work too, is making sure that consent forms are easier to understand in plain language. So yeah, there's lots of ways you can get involved. The best place to start is to go to the Royal's website. There's a research section, and in that there's something called About Clinical Research, and that's a great place to start.
Fantastic. And, you know, if anything, please contact the office. And so, you know, we're talking about consent, and, you know, Tammy, you have a great expertise in this context of consent. And I wanted to know if you could speak about it in the context of the spectrum of engagement in research.
Sure, absolutely, Florence. So the first step in the spectrum of research is really to inform. So we want to inform everyone that's involved. So our clients, our families, our researchers. So the aspect of consent is extremely important. So we have consent to contact or permission to contact. So that is really the first step to even learning about research when you come to the hospital. So essentially, under Ontario's privacy laws, researchers and research staff are not allowed to contact someone, a client or a patient, directly, unless someone within the hospital or someone within the care team has obtained that consent and said, yes, as a researcher, you can go and speak to this participant, this patient. So at the Royal, you might be asked during registration if you consent to being contacted for research. You might sign up on the research registry, as Peter mentioned, or your care provider might even ask you. If you're in an appointment with a psychologist, psychiatrist, and nurse, they may ask you, are you interested in hearing about research? Those are really important conversations to have, because what that means is that you are consenting to hear about research. You are not consenting to be in research. So it just means you're open to hearing about it, and that you're interested in the possible opportunities, what goes beyond normal clinical care. And this gives you an opportunity to be exposed to that. It allows our researchers to share potential options with you that are available outside of a regular care plan. So perhaps the care plan you're on, you're discouraged with, or you're not seeing the results you want. There are other options that you can explore. And we see that a lot, especially in things like cancer research. When the treatments are no longer working, many cancer patients will participate in a trial because it gives them a different option. Some research involve treatments that are not otherwise available. So essentially, when it comes to the research, we're advancing healthcare. I mean, to advance healthcare, we have to do that by doing research. And as an academic hospital, we're constantly striving to improve our care and to improve treatment options that are available to our clients and our family members. And there's a saying that it goes something like, if you keep doing what you've always done, you always get you keep getting what you always got, or something like that. And it's true for healthcare too, because if you think about it, if we didn't do research, where would we be? We wouldn't have insulin, we wouldn't have chemotherapy, the artificial heart that they use now, MRI machines, for example. So all of that has, developed because of research. So for me, I think research provides hope for the future, and it has that power to improve care. So when you say yes to be contacted for research, you're just opening up that opportunity to learn more.
That's fantastic. Thanks, Tammy. And Michael, back to you. As you look towards the future of client-oriented research, where do you see the future? Where do you see we are going? And what do you think we need to ensure we get this right?
I think the panelists have actually mentioned a number of these ideas. As Peter described, one of the things that I'm really excited about with the client and family engagement work group that a number of us I think all of us are part of, is that it does provide a structure to provide more education and awareness about what does this engagement and research look like? What could it look like? What does it mean? There's, I'm sure, many clients and family members who have questions about, how research works or how they could get more involved in the research process. And as Peter mentioned, there's also researchers who maybe don't necessarily have sort of everything they need in order to be able to engage more actively with that. Like I said, this is something that I've been involved in over my whole career, but I can imagine certainly for some of our newer scientists that there's some things that would help them a lot. The other thing that I'm really excited about is that, you can really see that funding agencies are recognizing the importance of having that client and family voice, so federally, Michele mentioned the SPORE, strategic strategies for patient-oriented research, that federally and provincially here in Ontario, there's funding programs that really highlight that as a priority. And then more recently at the Royal itself, we had, I think, a great inaugural grant competition, internal grant competition for the Translating Research into Care program, where it was, funding for smaller studies that were really focused on doing research that could improve care, where client and family engagement was at one of the explicit criteria by which the grant proposals were going to be judged. So it really put it front and center. It wasn't like, it'd be nice if you did it. It was like, we really value this and we want it to be in there. And the grants, the awards were recently announced, and I was just so impressed by the range and the quality of the submissions that were funded. So I feel like that's really the future, that there's a framework to provide that structure and support, and then there's really explicit prioritization of that kind of work.
Terrific. Thanks, Michael. And, I want to take 1 second to thank our sponsors for the translation of Research into Care competition. It's been funded through a donation by Canada Life with the work of the Foundation for Mental Health here at the Royal. So I certainly want to recognize all the teamwork that is happening to make all of this work happen and make this research a reality. And we are sort of at the beginning of this adventure, and the four of you over the past 6 months, together with the full committee, you've been involved in the development of the blueprint, really, for a client and family-oriented research framework that is tailored for the Royal. And I'm curious to know your highlights. What were the highlights for you? What did you learn through the experience? We are in a rapid learning health system. What were your highlights? And I'll start by Peter. You're on mute, Peter.
There we go. I'm not on mute anymore. Well, that's a great question. I think for me, one of the highlights, like an aha moment, I sort of already referenced this, was discussing the need for a curriculum to educate clients and families interested in engaging in research. And we were talking about this in our working group. And the aha moment was when actually several researchers said they'd like curriculum courses for them, so that because they had questions about what this means and how they can effectively participate. And so for me, that was an aha moment, that it's not just as clients that we have to learn how to engage in new ways. The researchers want to as well. And so the reason that was an aha moment was it almost sort of brings, it felt like we were peers trying to figure out together how we move forward in this new paradigm together. And so that was huge. I think, I think this really, it comes down to what both Michael and Michelle were talking about earlier, is using the word curiosity. And I love that word, and this is an aha moment as well, because there's a genuine curiosity on all of our parts that we want to make some significant improvements in the way we deliver mental health care, but we're not really sure. We know where we're going. We're not really sure like how all these pieces are going to fit together, but we're committed to doing it together, and we're committed to learning together. And I think that's been a huge highlight for me anyway. Thank you.
Fantastic. Thanks, Peter. And certainly has been a flagship of co-creation. What about you, Michelle?
Well, for me, in terms of my work to date, what's really striking me is the power of the connections of people, relationships, partnerships, and networks. When you bring curious people together and they're united in a common cause, which for our community is really to improve the experiences and outcomes of care for clients and families, that's when the real magic happens, and I'm always amazed at the ideas that come from the different parts of the ecosystem. And what, different people can contribute. Peter mentioned, the idea of we're all experts, right? We each bring a different perspective. And, so far in the gains that we've made, it's been very evident that when we bring together all of these different perspectives, for me anyway, that there's wisdom in that collectivity and that we can make things happen, on an accelerated path as well, which is really encouraging.
Terrific. Thanks, Michelle. What about you, Tammy?
Oh boy, there have been so many interesting lessons throughout this whole journey. I've been so fortunate to be part of this. For me, ironically, I'm listening to Peter and I'm listening to Michelle, and they're my co-chairs on this committee. And we didn't speak beforehand about this, but we're all kind of communicating the same message here, that our favorite experiences. But I think for me, the thing that stands out most, again, is the collaboration and co-creating with my colleagues, the clients and the family members. As a research administrator, I don't engage with a lot of clients and family members on a regular basis, except through committee work. So this really gave me that insight into the items that were of importance to them, and just hearing from them. We have a really diverse group with different perspectives and different experiences and different priorities and visions, and we all are working, like Michelle said, towards one goal, but we all bring such varied backgrounds to this. So I think for me, and somebody put this in the chat a little bit earlier, the vulnerability, the ability to be vulnerable and open and express what we're really thinking and what we feel, I think has made this the most rewarding experience, because without that, if people are reserved, we can't move it forward. We have to be open to that. So for that, that's really shed light on the value of that co-creation and incorporation of those different experiences.
Thanks, Tammy. And Michael, what do you think?
Well, echoing, what the other panelists have said, I have been really struck by the enthusiasm for, this principle and the practice of client and family engagement and research. I would say the highlight for me has been this sort of recognition that I realize we're going to be co-creating together as this framework develops, that there's not one way to do this. It's not like, well, this is, the framework doesn't say this is the way to do it and this is how you're going to do it. It's not prescriptive in that way, right? It's really, if curiosity is the research part of it, for me, this framework is about choice, that there's lots of different ways clients and families can be engaged. They could be involved in the councils or in the committees that we've been talking about. Somebody would be, might be interested in visiting that webpage and say, you know what, I am interested in participating in research. Somebody else might say, well, I don't think I am ready or interested in participating in research, but I want to learn about what's going on. I want to see what kind of research is being done. I'd like to learn about the results. I'd like to learn about how those results are going to be used to feed back into the care that you provide. I'm very hopeful that there will be some who are really interested in being even more actively involved in the research process, that they want to be either the sparks for it by asking those kinds of questions, which I so appreciate. And this is maybe my chance as a side note that there's, as part of our Royal Research Week, there's an Ask Me Anything for a number of researchers, including myself. And so that's, I think it's a great thing to be doing on its own. And I also see it as an opportunity to maybe do that sparking and really spark some thinking about new research that could be done. Back to my main point, that people might be interested in sparking research, or might be interested in being active collaborators. So I talked about the Translating Research into Care grant competition. One of the ones in the Forensic Mental Health Research Unit that I'm so proud of is one where we've got clients who are part of the research team. They were right in the beginning in terms of conceptualizing what the study is going to do, how it's going to work out, gave feedback on early versions of what kinds of questionnaires. They were actively involved throughout, and I see that as a great example of an opportunity for somebody who really wants to be that actively involved.
Terrific. I really want to thank you, recognize you for your leadership and your engagement, your excitement, your passion in steering this framework. It's really remarkable. And, at this stage, I think we have a number of questions from the audience, if you indulge me. And so the first one is, do we have any sense of what clients and families are themselves wanting to learn more about or think should start to be researched? What are the categories of research? Someone interested in jumping in?
Well, I don't mind taking a short stab at that, at least for the first part. I think, to be fair, we have a sense, to use that word, of what families and clients are interested in, but we do need to do a little bit more work. We do need to reach out and ask specific questions. But the sense is, having had sort of informal discussions with client family members on the various councils and committees that we're involved in, is that there is a genuine interest in in the sorts of non-pharmacological care. That's a huge interest. What are sort of lifestyle interventions, in addition to the various therapies that we can engage in to improve our various mental health conditions? I think that's a really big one that a lot of people seem interested in. We recognize the importance of medication, but we want more than that, because at some point, we want to be able to feel like there's hope that we can be healthy enough to lead a healthy life without medication. So what do those interventions look like? That's a big question, I think, for a lot of us. With regards to the categories of research, I think I will probably leave that to somebody who's better informed than I am.
Florence, I can speak to the categories and the different types of research. So I think when people talk about research, they automatically, and I'm using a previous example because this is what I've been told in the past, they automatically think guinea pig, right? It's like, I'm a research guinea pig and people are using me to test something. That is not actually what research is. Research can be so many things, and it can be in such a variety. So there's research that is strictly done through chart review and data review. So gathering data that's been collected through clinical visits that maybe will give us some guidance about a question that needs to be answered or a treatment that needs to be addressed. We have observational type research. So just interacting with our clients or interacting with our participants in some way, shape, or form, and just gathering data from that. Survey research. I'm sure there are many people that saw the COVID How Are You Coping survey that was put out by the Royal, and it was out online. Again, that's a way of collecting that data. So that is a research study. And like Peter said, we're moving, we want to do research that is not just clinical trial based or pharmaceutical based, but different interventions as well. And we have different interventions. We have our TMS, we have observational studies that include, for example, going through the scanner. So, it really depends, but there's so many ways to be involved in research. There's so many types of research.
Thank you both so much.
Could I jump in too?
Absolutely.
But I want to make sure we have time for other questions as well. So just excellent answers. I would just add that hearing directly from people about their experiences is another form of research, right? Whether that's in the form of individual interviews or focus groups, or anonymous surveys, but hearing, not just saying answer these questions about whatever the topic might be, but like what has your experience been like? And I'll give you one example where in this case the Royal staff were the research participants. My team a few years ago were involved in a study looking at experiences at the workplace for psychiatric staff, and so we did big surveys and asked lots of different questions, and actually quite a lot of staff, I was really gratified, were willing to participate in that. Part of that research study, though, also involved having these small group focus groups and individual interviews with staff to sort of flesh out what we were learning from the surveys, and those were tremendous. I don't think that project would have been successful with only one part. Just the survey would have been good, but not as great as the whole thing when we also had that sort of lived experience part of it as well to sort of flesh out what we were finding.
Terrific. Thanks, Michael. So here is the next question from the chat. Do you have ideas of what we could do as researchers to increase the involvement of clients and family members as participants in our various studies, as well as content experts who would like to work with us on various research projects, especially in the current context of the pandemic?
I guess I will take a crack at it. I think it's putting the interest out there and using all of the communication vehicles, all of the available networks, all of our partners to get the word out, and making it easy for clients and families, one, to recognize that they would be eligible and valued members of the team. And then, just getting the word out fundamentally of what's available, where the opportunities are, and tapping into the councils, tapping into the various networks and partnerships that we have.
Absolutely. And as we know, our team in communications, they have been great partners in disseminating all this study. And this is a shout out to Kate Abernathy and Michaela for setting us up so well today and for really making bridges and connections. So thank you very much for that. And, it's already almost 2:50. Time flies when in good company. We have a bunch of other questions, so we will put it on the website with some answer and some contacts where we can continue the conversation. Such a great conversation. I want to thank you again for a great discussion, a great panel. Thank you also to the whole working group working currently on the client and family-oriented research frameworks, which will be launched by the end of the year. I want to say thank you to the audience for being here today and celebrate Research Week with us. And this event was recorded. It will be available on the Royal website. And also I am receiving a message that we can also use the social media channel to keep the conversation going. So thank you again so much for sharing and for your leadership.
Thank you. Have a great afternoon, everybody.
Thank you.
Thank you.
Thank you.